What we're doing here at Rogers is very unique. We are really the industry leader in outcomes in behavioral health. For some reason, behavioral health is kind of behind when it comes to some of these kinds of things, but we've been really working for over 20 years to kind of establish where we're at with this. And of course, we have an outcomes department, a dedicated staff that's sole reason for being is to measure these outcomes, analyze these outcomes, and of course that is data that we can use in our system to continue to improve our programming.
At Rogers, our research not only benefits us as an organization, but it's benefiting the field of behavioral health in general. With our research partnerships, we typically produce around 30 peer-reviewed publications per year. So we're not only keeping this data and learning from it with ourselves, we're contributing to a larger scientific field of establishing best practices for treatment of behavioral health disorders.
It's really important that we're collecting this outcomes data because what it allows us to do is show our patients who are coming into treatment that they're not alone. There are other patients who have come into our programs before who have similar symptom severity and have made huge progress. So this shows our patients that there's hope for them.
So when we talk about using outcomes measures, they don't rely upon how well you like your therapist. They rely upon things like tracking behaviors that were a concern, how often they were happening, how long they've been happening, now how often are they happening, 2 weeks later, now how often are they happening, and when it's time to discharge, what we hope to see is behaviors we didn't like that were happening here are now happening here. They're the most objective measures that we can find that are out there to talk about what's actually happening in your life.
It is really imperative that we make sure that the treatments that we use with our patients work. Our goal is to become the best behavioral health system in the country, and we need to make sure that the programs that we have provide empirically supported or research-based treatments and that we can do those treatments to the best of our ability.